Today's episode is about global and public health professions. Biostatisticians. These people design experiments, questionnaires, and surveys to collect data on people and health. They will not only collect the data, but will also analyze it and create reports explaining their findings. Dentists diagnose and treat problems with patients' teeth, gums, and related parts of the mouth. Emergency management directors prepare and develop plans to respond to natural disasters and other emergencies. Environmental scientists protect both environmental and human health by collecting data and developing regulations that restrict air and soil pollution. They share their information with the government, businesses, or the public. Epidemiologists work to reduce negative health outcomes by recognizing and researching the causes of disease and injury among populations. A food inspector is a public health professional who ensures that meat, poultry, and other related food products processed in private plants meet safety and labeling requirements. Health and safety engineer. These people design systems and procedures that prevent people from getting sick or injured. Health educators develop public health campaigns and programs designed to address specific health and safety issues within certain populations. Healthcare consultants provide consulting services to state and local public health officials and other healthcare providers. Their work includes reviewing and analyzing the effectiveness of the programs and services they offer. Some of the programs they analyze include maternal and child health, substance abuse services and programs, health screening, and health education. Hospital administrator. These professionals create budgets, coordinate medical services, and hire doctors and other medical professionals. Infection preventionist. These are public health professionals who oversee the medical staff of a healthcare facility to ensure that all medical professionals are taking the proper precautions to prevent infection and the spread of infectious diseases. International global health and development workers are employed abroad to work with developing countries to set up long-term, sustainable solutions to problems. A medical and health services manager supports a clinic, department, or group of physicians by directing and coordinating health services. The main goal is to improve the quality and efficiency of healthcare services. Duties range from billing and scheduling to representing their team at board meetings or with governing bodies. Natural science managers are responsible for keeping scientific research programs and initiatives moving along in the most effective, efficient fashion. They are also responsible for assembling the team of research professionals and assistants, overseeing the budget of the program, monitoring the progress of the research, and working closely with executives and researchers to develop goals and strategies. A nonprofit coordinator oversees the public health projects of nonprofit organizations, private companies, and federal agencies. Their work may include leading a campaign to help fight child obesity or to raise awareness for domestic violence, or designing a public health initiative aimed at emergency preparedness, air pollution, or COVID-19. A nutritionist develops nutrition programs, systems, and policies designed to improve or maintain the health of specific groups or populations. Their work often involves creating and implementing programs that help change behavior attitudes, and knowledge about nutrition to help improve health outcomes. Occupational and health safety specialists. These people inspect and evaluate equipment and best practices in workplaces. These professionals make sure employers follow government regulations and safety standards. Policy analysts. These people research and track changes in public health, prepare written briefs and journal articles, and track pending legislation. We depend on these workers to make critical decisions. Policy and advocacy advisor. These people develop, lead, and execute a comprehensive advocacy plan with specific goals, objectives, and indicators with a focus on partnering with the global community to affect both national and global health policy changes. Primary care physician. This is a family medicine doctor who's trained to prevent, diagnose, and treat a broad array of illnesses and injuries in the general population. Public health attorneys work with local, state, and national government officials to devise policies, set regulations, and pass laws concerning public health standards. They may also advocate for patients and victims and pursue lawsuits against companies and organizations that violate public health standards. Social and community service managers supervise workers who provide social services to the public. Such services may include those focusing on a specific demographic, such as children, veterans, senior citizens, or the homeless population, as well as those with particular challenges like substance abuse, mental health issues, or long-term unemployment. Travel nurse. These are healthcare workers who travel to patients and assist at healthcare facilities. They perform typical nursing duties and provide care in residential areas, at schools, and other organizations. Travel nurses also assist when hospitals are short-staffed. Water quality planner. They study water ecosystems like rivers and estuaries, as well as man-made water systems like wastewater treatment plants and drinking water supplies. Their work largely involves studying water systems, performing scientific studies, and writing reports that are used by governmental agencies, nonprofit organizations, and private companies.